Hi, welcome to Republican Roundtable. I'm your host, Jennifer Zielinski, and thank you for joining us. Today we are with former Senator Michelle Benson. Thank you for joining us.
I am so glad to be here. Thank you for welcoming me.
You have a lot to talk about today. We're just getting into the 2024 session with the Minnesota legislature, and we've got some issues that's going on with them.
Well, and actually, this week, we're at the end of January as we're taping this, they're hearing a physician-assisted suicide bill. They will be taking votes, so outside of session, highly unusual to take votes outside of session. I think this has happened 6 times since 2016. And so the first actions they're taking in this legislative session will be moving forward physician-assisted suicide in Minnesota. So I've been working as the outreach coordinator for the Alliance for Ethical Care. The Alliance for Ethical Care, mn.org, is where you can find out more information about this bill and what we can do in a bipartisan effort, broad spectrum of people who oppose this kind of legislation in Minnesota.
And heavy topic too. There is controversy with it, but just to back up, you've served on the Senate for quite a long time, for quite a few years there.
Yes.
Have you ever seen legislative sessions like this where we are pushing bills through so fast?
Well, I was in the Minnesota Senate for 12 years.
Okay.
Last session, I had stepped away so that there's a little bit of gap between the time I serve and the time I advocate. But I tell you, last year was unprecedented. The speed that they moved things through, things were not amended. And we're actually seeing some pretty serious consequences. The cannabis rollout is not functioning well. They were way off on fiscal notes on things like paid family leave and school lunches. There are many problems with moving legislation this quickly, and I hope that because of advocacy and because of some thoughtfulness at the legislature, that physician-assisted suicide doesn't get just rushed through.
And we're seeing just bills, no amendments. You said no committee hearings.
Well, they would have hearings, but they wouldn't be changed through the entire process, or they'd skip an essential committee in their zeal to get some things done. Great to get things done, really bad idea to get things done the wrong way.
Absolutely. We're not, ironing out the details, getting the issues.
Right.
And this should concern voters, especially as we're addressing, I think, probably one of the heaviest topics, physician-assisted suicide. As we get in, what are some of the concerns you're seeing already with this bill?
Well, there's a major amendment as we're going into this hearing. There aren't conscience rights protections for providers, so a provider, a doctor, who gives a terminal diagnosis would be required to tell the individual that physician-assisted suicide is available to them. Can you imagine being that care provider who their entire life has been to heal individuals, now being, because of the law, compelled to say physician-assisted suicide is available? So we need conscience rights protections. My preference would be that we don't do this at all. We spend millions of dollars in Minnesota on suicide prevention, telling people that their life has value and that there is, another step that their life needs to take. And now we'd be saying for some people, their life doesn't have value. We need to always balance the rights of the individual with our overall state policy of saying you are valued and you are heard. There are many end-of-life options: hospice, palliative care, making sure you have a health directive in place. So we're not just saying no. The Alliance has actually worked a long time on making sure that palliative care is paid for and accessible, that hospice is paid for and accessible, and that we have good legal options for individuals to direct their care. And so most physician-assisted suicides in places like Oregon are because of fear. A fear of loss of control, a fear of being a burden to their family, a fear of financial risk, having to sell their home. Well, what we know is hospice is covered by Medicare and Medicaid. We know that you can put a durable legal directive in place so that you can say what the end of your life looks like. And I would encourage everyone, talk to your family about what you want the end of your life to look like. Make a plan so you can reduce some of that fear. So I've gone into a lot of detail. So what are your questions?
And that just seems like that side no one wants to talk about, but it's so important to think about those steps you have to take at the end. But if you have that choice, physician-assisted suicide, you can't undo that. You can't.
You can't.
You can't. There's no going back, especially if there is a cure. There's a possibility you could live more quality, good years.
And what we're seeing in places like Canada, it starts out being about a fatal diagnosis, about a terminal diagnosis, and it moves to people with disabilities. There was a veteran, a disabled veteran, who was actually denied care and encouraged to get physician-assisted suicide in Canada.
I read about that.
Not that far away, and it hasn't been that long that there's been physician-assisted suicide in Canada. And so people talk about the slippery slope. I don't want to be conspiratorial or get ahead of where the bill is at, but let's be clear, once we start saying someone's life doesn't have value, it becomes very easy to just take one more step. And we don't want that to happen here in Minnesota. As you know, as everyone watching knows, around the world, Minnesota is known as a place where you come for healing.
We have the Mayo.
Yes. Well, and other excellent health care. People come from Canada to Duluth to get health care. We don't want to change that conversation in Minnesota.
And what are we seeing even in states that have authorized this or allowed this, like Oregon? What are we seeing with physician-assisted suicide?
Well, we're seeing increased evidence that when physician-assisted suicide is in place, other forms of suicide actually increase. We don't want that for Minnesotans who might be feeling despair, who might be feeling hopeless. We want to continually send them the message that we're going to support you, we're going to find ways to help you, whether you have a terminal diagnosis or you're going through a crisis of another kind. We want to make sure that you're well supported, and we do that really well here in Minnesota.
And that was kind of my concern too, is the mental health aspect of it. We've worked so hard to bring mental health, bring the limelight on mental health, that it's not a partisan thing. Everyone should be concerned about mental health. And now we're introducing something that can exasperate it or exasperate that move towards.
Or if someone is facing a real mental health crisis, we want them to be able to work through that and not have a message from the state of Minnesota that there are some lives that just don't have value. But I want to say something else. You talked about we. When we say we, let's talk about the broad spectrum of Minnesotans who oppose this bill. There are 90 organizations that have joined the Alliance. Autism groups are presenting their letters in this hearing saying individuals with autism might be at higher risk because it's easier to talk someone into something when they might not feel fully autonomous. Disability groups are opposed to this. We have veterans groups that are opposed to this. This isn't a Republican issue. This isn't a Democrat issue. This is a caring for people when they're the most vulnerable issue. And so, while at the Alliance we talk about our opposition to physician-assisted suicide, we want to make sure that people are heard and valued, which is why we also talk about palliative care, hospice, and your legal options for controlling your life as you go through this end stage.
And what organization are you with again?
I am with the Minnesota Alliance for Ethical Care. So ethicalcaremn.org is the website if you're interested in learning more, hearing some of the stories, seeing who's in our coalition. Lots of medical providers who don't want to be in a position of saying to their patient, I'm not here to heal you anymore. I'm here to give you this option to end your life. They don't want that to be part of the standard of care here in Minnesota. So they've joined with us. We have dozens of doctors, and that number is growing every single day. We have hospice nurses, and that number is growing every single day. They want to provide appropriate care for a person who is struggling at the end of life.
And some of the people who are on the pro side, who are pushing for this, how are we addressing issues? They always bring up it's, the care, it's about giving them that quality or that choice at the end. And what are we saying to them?
About 6% of suicides, physician-assisted suicides in Oregon, were due to pain. We have good pain management. And certainly, let me be clear, I don't want someone to suffer. But we have good pain management, and fear is the reason for most of the other provisions. So fear of being that burden to loved ones, fear of financial risk, fear of losing control. And that's why I encourage people, talk to your loved ones. get a healthcare directive in place, understand that hospice care and palliative care are covered services in Minnesota, and we can send clear message that your life has value regardless of what stage your life is in. I want to go back to some of our care providers. We fundamentally change that conversation if we put physician-assisted suicide in place. We want Minnesota to be a mecca for healing and not physician-assisted suicide.
Yeah, I saw that issue in Canada where they were giving that option to veterans. And these are people who have served their country, I should say not our country, but their country. Canada's one of our allies, so they've probably served our country as well in some aspects.
Yes.
But they're given that choice where they're young, they're healthy, they just need some extra assistance in their medical care.
And Canada is rapidly going down this path. Some of it is
sad.
cost saving, some of it is just a fundamental change in the culture. And so let's build a culture of dignity, and let's build a culture of talking about really hard things so that people don't feel alone and isolated. But this is wrong for Minnesota on a number of levels. And so let's be really clear. We need you to reach out to Republican and Democrat. As I said, this isn't a partisan issue. People across the political spectrum from all walks of life, from groups like Native Americans, the Hispanic community, the Hmong community. This is not part of their culture. And so let's make sure that those voices come forward as well.
Absolutely. And when your organization is reaching out, what are you talking to people about and what are you hearing from people?
There are a lot of people who didn't know this was going to happen in Minnesota. So this is kind of a surprise, which is why thank you for having us on the show.
Yes.
We want to make sure that people know this is coming because now is the time to stop it. And so they're surprised that it's coming forward. They're surprised that when we have internationally known healthcare, that this would be part of a healthcare conversation. And when we have worked so hard to talk about mental health and avoiding suicide and making sure that people have access to the resources they need, that this is an answer to that question. It's not appropriate for Minnesotans.
It also just takes away that dignity that they have at the end of life.
And,
you know,
and sometimes at the end of life, people don't feel like they have dignity, which is why we as loved ones, as supporters, need to say to them, we'll be there, we'll walk through this with you. I know there are people watching right now who've gone through this with their parents or with a loved one or with a spouse, and I know it's hard. I would never trivialize how hard it is to hold the hand of someone you love, but we're asking you to hold their hand and walk through with them, not rush to something that is inevitable.
And when we are addressing this with the legislature, we know we kind of touched on this, they're moving it so fast. Is there a reason they're trying to push it into committee? I mean, even before the session really gets going here.
And well, they had a lot of bills that they pushed through last year, and largely they were rewarded for that. And so I think they're saying, let's just keep pushing.
What are the concerns you see if we do push this forward push it forward as quickly as possible?
Well, lack of conscience rights for the doctors, for those hospice nurses who would be in a position to have to say physician-assisted suicide is available to you. Lack of conscience rights for nursing homes and hospitals that say we want to be places of healing. We want to be places that hold the life of that person as sacred. And not be compelled by the state to offer physician-assisted suicide. We want to make sure those rights are in place. There's a provision in this bill where you can get a life insurance policy just months before physician-assisted suicide. Now, I know that seems like a technical thing, but many life insurance policies are written, you can't go dive with sharks, you can't jump out of airplanes, and they're not valid for a year if you commit suicide. But that would not apply in this circumstance. They also won't list physician-assisted suicide on the death certificate. So as we went through COVID, there was controversy about what was ascribed as the cause of death. There are parts A and B.
I remember that from that.
So if you have cancer, I would say put cancer as part B, but physician-assisted suicide as part A, so that we can see transparently who is opting for this. Is there a pattern? we don't need to hide this. We don't need to keep things from the public. This is an important conversation. And if you don't want it on the death certificate, I think that's a big clue as to how bad a fit this is for Minnesota.
Well, and especially as we're trying to advance cures in science, and we're trying to look for that cure for cancer, that cure for diseases that we see that affect us. Take what you want from COVID, but how can we lessen the effects of the next major disease? What if somebody had COVID and they were on that ventilator, and now the physician walks in and says, well, you have a couple of choices? I mean, how does that look for even just us researching for cures?
Well, and I think in particular when it comes to end-of-life issues, understanding who's making those decisions and how they're impacting patients is really important to our healthcare system overall.
And what if this gets into the insurance world? Are they going to start giving those options? Like, we're not going to cover this treatment, but we're going to cover...
I'm less concerned about insurance companies in particular, the pressure that a family member or the guilt an individual might feel. If somebody says, well, we're looking at having to sell our home in order to pay for your end-of-life care, that might put undue pressure on an individual to rush into physician-assisted suicide. And that's why it's important that we have that conversation. You have the right to receive care. You also have the right to refuse care. You do not have to spend the end of your life hooked up to machines, on a ventilator, doing everything you can to prolong your life. But what we want to make sure is that nobody rushes you through
Absolutely.
the end and ultimately to death.
And that can just be a scary thought that like you said, you have those choices, but no one is forcing you towards those choices. It's not family, it's not the doctor saying, let's try this instead. Because like I said, you can't get somebody back from once you take that route.
Exactly. There are some other concerns with the bill. For example, you're given a prescription, you're sent home. Nobody has to witness you take this. They'd like you to have somebody with you. Of course, that would be wise, but you don't have to. So what if something goes wrong?
I also have the concern where we have so much drug abuse with like the fentanyl and everything else going on. What if a family member gets a hold of that, or you're getting that for somebody else?
And so you do have to, in this bill, you would have to sign a form taking responsibility for it.
Okay.
So some of the technical things could probably be worked out, but the fundamental idea that you would go home and take this without medical observation, it's not really physician assisted if they just send you home with it. So what happens if something goes wrong? What happens if a family member is there to help you and you change your mind? So these are some things that we need to be really cautious about. We need to make sure mental health evaluations, we need to make sure that the people who are assisting in this have no financial stake. So every time this bill has come up, concerns have been raised and they change the bill. And so let's keep raising concerns, keep pushing back. It's important across the political spectrum, Republican or Democrat, if you're concerned about this issue, be prepared to tell the story of a loved one. Be prepared to raise concerns about what kind of message it sends when we say some lives don't have value. Be prepared to tell them you don't want our hospitals and nursing homes to become places where death is encouraged instead of being places of healing.
And that's just what really scares me too, is when we're going to push this forward, I think it's just that wrong path. What are some of the things we've seen, or some of the, I like to say safety stops we haven't seen in Europe and Oregon, and I blank on other states that have.
So Europe is far ahead of us on this. They are now talking about minors, and that is not in this bill. So I want to be very clear. That is not in this bill. Mental health diagnoses are now being considered for physician-assisted suicide in Europe. Again, not in this bill. But this is where the advocates for this have pushed Europe. The advocates for this have pushed Canada. And so They're going to keep pushing across the United States. Minnesota doesn't need to be a leader in this.
No.
Minnesota can be a leader in healing. Minnesota can be a leader in innovation. We can be a leader in taking care of our elderly, the disabled, those who might have autism or have other concerns. Let's be a leader in those things. Let's not be a leader in physician-assisted suicide.
And people with disabilities, how they can live that quality life, whether it's a mental health concern, whether it's a physical disability, or both. We can give them that quality of life. We can give them a good...
And they can embrace it.
Yes.
They can say, I'm going to live to my fullest potential. And Minnesota's the place to do that. Let's keep sending that message. Let's keep sending the message that our elderly are valued, that people, when they're at their most vulnerable, will be heard, will have their hands held. Let's not rush this, whether it's the legislative process or physician-assisted suicide itself. Let's protect Minnesota's nation-leading healthcare system. So everybody's going to need to reach out through ethicalcaremn.org. You can learn more there. You can get action alerts, so as we continue to have more hearings, you can fully participate in sending a message about what kind of healthcare system you want here in Minnesota.
And this is the political year. You know, we have obviously the presidential election taking the spotlight, but this isn't the year to sit back and ignore Minnesota politics. Everyone has to get involved if we want to stop this and any other dangerous bills. And I'll call this a dangerous bill.
Well, and being engaged is a privilege of a representative republic. Nobody else is going to do this for you.
Yep.
You can't keep counting on someone else to be your voice. So if you're a member of a community with Down syndrome, with other forms of disabilities, if you work at a nursing home and you don't want to have the obligation to present physician-assisted suicide, if you're a doctor and you don't want this option, sign up, get involved, send a message. It's very simple. We're not going to expect you to sit at a committee table and tell your story, but we want to be a voice for you and with you.
Absolutely. And then what else can anyone who's watching, what else can they do if they are hearing this and they're like, wait a second, we need to stop this?
So there are a couple of things that we need to do. One, you need to reach out to your legislator, ethicalcaremn.org. And number two, talk to your family. Start making that plan, because we can do the politics, but we can also change the culture. And death is not something people like talking about. Talking about death with you,
It's sad.
it's not easy. But if you talk with that loved one, make sure they know what your plan is. Make sure that you have access to palliative care, that you've thought about what hospice might look like for you. And that's how we start changing this culture. Most physician-assisted suicides are because of fear. So let's take away some level of that fear. No, it won't be easy, but it's really important. And so one by one, we'll change the culture. One by one, we'll send the message to our elected officials that this is not right for Minnesota.
Absolutely. And when you said like only 6% are really about that pain, that just, it throws it off, because this isn't being used for the pain care and the quality of life. It's being used because people are afraid.
Fear of loss of control, fear of financial losses, fear of being a burden to loved ones. So let's take away some of the fear. Let's change the culture around how families care for one another, how we see our nursing homes and hospitals, and reach out to your legislators. This is the time. Don't wait.
Don't wait. Don't sleep on this legislative session.
No, absolutely.
And get to know your representative. As a representative, as a senator, when you took that call from somebody who may have been on the other side of the aisle, did you take that into the consideration?
Absolutely.
They're your person.
If somebody's going to take the time to reach out to you, listen to their story. You might disagree with them on principle, but everyone deserves to be heard. And so that's what this is about. And I have confidence that the people listening to this show will be respectful. They will tell their unique perspective on this. They'll raise concerns about conscience rights. They'll raise concerns about Minnesota being known as a place for healing. They'll raise concerns about standing up for people with disabilities who might feel more vulnerable in this circumstance. We've got good people in Minnesota, and across the spectrum from all walks of life, we have opposition to this bill. So it's House File 1930.
Okay.
It is moving in the Minnesota House. It's moving out of the Health Committee. They're planning votes on it. As we speak, they're planning that hearing. So by the time this is aired, it will, I am confident, have already gone through that hearing. It'll be one of the first things they take up in session.
And unfortunately, one of my representatives is behind authoring the bill. I'm still going to call him, but he's one of the authors behind it. But I'm going to take that moment and make sure he understands where I stand on it.
And I'll tell you, as an elected official, I appreciated people who were educated on the issue, who were polite, who said something unique. At the Alliance, we don't do robo emails. What matters to you is what you need to communicate. We'll facilitate that.
Well, thank you. It's, I think, a heavy topic, but it has
is.
to be talked about.
It is. But as former Health and Human Services Chair, we talked about a lot of heavy topics. If it's taking care of the disabled, if it's how we fund our nursing homes, difficult things can be talked about. Let's be respectful. Let's get educated. Let's know where our values are, and let's think about what we want from Minnesota.
Well, thank you.
Absolutely. Thank you very much. Glad to be here.
Thank you for joining us on Republican Roundtable. Until next time.